The UAE has a growing elderly population making up about 4% of total Emiratis. With better medical facilities and healthier living standards available in the country, life expectancy figures are equally improving. But with longer lives come greater needs, as a growing number of elderly people require quality healthcare services. Gopi Krishna has this report.
The UAE has a growing elderly population, and the extended Emirati family is a perfect mix of the young and the old. With the increase in the number of Emiratis aged above 60 years, there is an obvious need to meet the ever-growing demand for medical facilities for the elderly. But elderly care is more complicated and a commonly misunderstood concept. As experts in the field of elderly care suggest, age is a major factor in the healing process of a patient, which adds a whole new dimension to treatment methods.
These individuals can feel very isolated during this time of their life. They may see, for example, that the people in their age group are now growing old as well. They're experiencing health difficulties. They may actually witness many of their friends that are dying. They may also experience the loss of a spouse. And a huge thing also during this time is feeling like a burden. Now, the elderly may experience this because they have to worry about their children. They used to be the caregiver, but now they have changed the role. They are now dependent on their children for support and for assistance. And so they may feel very isolated and feel very burdensome to their children. So that is why we as mental health practitioners need to help the elderly and need to help the families to make this transition easier for them so that they can prepare for this and they can make this easier for themselves and they can understand that these are normal changes that they're going through and they can still try to find other outlets through which to find meaning in their lives.
The Dubai Health Authority recognizes the challenges posed by geriatric care. At Al Mamzar Community Health Center, Dubai's only center for the elderly and catering only to Emirati families in Dubai, a wide variety of health and social services are offered, including psychiatric care. Dr. Amal, who is the consultant and head of geriatric care at the center, says that the center's objective is to welcome and look after senior citizens, but agrees that the treatment provided by specialist doctors has its limits, and the center in no way can replace the care offered by a family.
The role of the caregiver also, it is very important. We are dealing with the patient and we are dealing with the caregiver as well. Even during our home care program, we are training the caregiver, teaching the caregiver, reassuring the caregiver, because the role of the caregiver is very important because he is taking the care of the patient at home. Especially patient who is having a disability, either mental or functional, they need help. So we need to support the caregiver. So this is our role.
Mobile geriatric clinics are one concept designed and implemented by DHA to help those elderly patients who cannot physically come to the hospital to seek medical help. More than 4 years into the program, this team of specialist doctors have already helped hundreds of senior Emirati citizens by visiting their homes and providing them exclusive care in a homely environment. The mobile geriatric clinic makes up to 3 to 5 visits per day in Dubai, and the doctors discuss and advise the caregivers about any changes necessary in the care meted out to the elderly.
The mobile geriatric services in DHA, which is actually the home care program, we established in 2012. And we are targeting the elderly who is 60 and above with disability, either functional disability or mental disability, and they cannot follow their condition in the clinic. So we are providing the services for them at home. Actually, we have 3 types of mobile services in our elderly home care program. We have the mobile medical unit, providing the comprehensive care for the elderly at home and following their condition at home. We have the mobile rehabilitation unit, and recently we introduced the mobile laboratory unit.
As we can see, the government and healthcare practitioners are carefully designing and improving elderly care facilities. Although much more needs to be done, with facilities like mobile geriatric clinics and many more in the pipeline, the future for the elderly care in the country is only looking better. Gopi Krishna, 7 National News.